Please welcome to the stage Cheyanne M. Daniels, race and politics reporter at The Hill, joined for a panel on barriers to postpartum care with Adrienne Griffen, executive director of the Maternal Mental Health Leadership Alliance, Chandrika Balgobin, medical director at Inova Women's Behavioral Health Services, and Stacey Brayboy, SVP of Public Policy and Government Affairs at March of Dimes.
Thank you all so much for joining us today. This is such an important conversation. I think the topic of mental health is one that's becoming a little bit more talked about generally, but we know statistics show the outsized effect that it has on pregnant Black mothers. And so I want to take a moment. As we're seeing some of the stigma around mental health decline, where is it or why is it still impacting pregnant Black women when it comes to being able to ask for that help and say, I'm struggling, I don't know how to relate to my child, I don't know how to pull through this pregnancy, I don't know how to talk to my partner. How do we start to have those conversations?
Right, so thank you so much. First of all, thank you everybody for being here, and thank you to Sage for sponsoring this event. And to my lovely panelists, we got the memo on the purple, and we framed Chandrika so nicely. So back to that question. So, let's just look at the numbers, right? 1 in 5 women will experience anxiety or depression during pregnancy or the year following pregnancy. And we know Black women are at even higher risk, as are other historically marginalized populations. So women of low income, Native American women, there's lots of women who are at higher risk. Why is it so hard for Black women in particular to talk about this? Well, we know that mental health across the board has been so shameful, but particularly in the African American community, right? And there's the strong Black woman mentality. Black women of color, have been disproportionately impacted by child protective services. So if acknowledging that you have mental health conditions, there's real fear that your child may be taken away from you. So I think there's a whole host of issues that make it harder for Black women to ask for help.
Yeah, and tell me a little bit more about that, what you see in your own research and in doing this work.
Sure, so I'm a reproductive psychiatrist. I work with OBGYN and maternal fetal medicine, also known as high-risk pregnancy. So some of the things that we see include sort of having the conversation, introducing this as a potential consideration in pregnancy and the postpartum period, understanding that this is a possibility, and being able to ask for help, normalizing conversations about the potential for anxiety and depression and the prevalence that we may see. Also, the prevalence is higher in high-risk pregnancies, and as we know, there are factors with regards to proactively seeking help and seeking health care and barriers that may affect the ability to do that. And they manifest in pregnancy in a way that can affect the prognosis of pregnancy and potential prognostic factors in the postpartum period, affecting outcomes both for the maternal side and baby as well. And that comes up as well in the NICU setting as well. So it's also about education and understanding expectations, and then also being able to consider resources. So the ability to screen appropriately and refer. One question that I often get from colleagues is, if screening starts, how do we refer? And how can we ensure that there's adequate referral sources? And that comes up in different media. The Maternal Mental Health Report Card, one of the domains includes access to clinicians and programs. So that is one consideration as well. So it's multi-layered, it's complex, and we need to do better.
Yes, and Stacey, is there anything you would like to add?
Most definitely. So what my colleagues have shared is everything that I wanted to share with you, but I want to add just a few more additional personal comments as it relates to this. So one, I think it is wonderful that we're all here and that we're highlighting the importance of maternal mental health. And so I do agree with what the senators have stated earlier. When we're not able to go into a room and separate health and mental health, when we can look at it and a holistic approach and way. As an African American woman, I will tell you, who's also a mother, as we talk about the stigmas that face the African American woman in the community, they truly do exist. They exist from the stereotypes of if their resources are available. We're challenged with, if we come forward and we say that we're suffering after giving birth to a child, that we're dealing with postpartum depression, or if in some cases this postpartum depression leads to, could be substance abuse. It could be you're willing to say, I'm not able to take care of my child. How do I get help? Where do I go? Many times it's because you're not educated on where to turn to, or you don't feel comfortable talking to your provider. And then of course, providers are not trained, as you've heard, or in states and providers. There's not support to be able to educate or offer those services or identify those services in the hospitals, in NICUs, and we've heard this from the story, the presentation we saw earlier. It is being able to identify those things earlier. My personal story, I want to open up and I want to share. I don't want to have it viewed as a stigma not to tell it, but I will tell you that I also suffered with postpartum depression. It was me trying to figure out who do I call? Where do I go to get help? And you would think, me being right here in Alexandria, Virginia, wonderful, wonderful team of providers, but nobody readily identified it for me. It was me being proactive. I guess that's why I'm an advocate that's in the space. I know that's why I'm an advocate in this space. It was me being proactive to go and seek out groups to be able to talk to. And then I know we'll get to this hopefully we'll get to it a little later, but I've heard it mentioned in the first panel with the senators. There is a lack of providers, therapists, psychiatrists, networks for women of color, but not only women of color, but for women in general, to be able to go and seek help. And then once you get on a list, is what I had to do. I had to get on a list in order to be able to go to a group to talk about having postpartum depression. And then so it was me advocating for myself that we were able to identify who I needed to be able to go and talk to, because I would take my daughter to the daycare and then I would pick her back up, because I was starting to do half days because I had to return to work. And I would just look at her and I was thinking, what in the world are we supposed to do now? And so what I would do is I would get into bed, I'd go to sleep, and the only reason that I would go to sleep, because I was depressed, I would go to sleep, but the only reason I would wake up, because I knew the child needed to be fed, I knew that she needed her diaper to be changed. So there was still that part of, I need to take care of this child, but I suffered in silence. And so there are a lot of women who suffer in silence when it comes to postpartum depression, but depression and have mental health issues coming from giving birth to a child.
Yeah. Can I just pick up on something?
Absolutely.
Right. So I'm so sorry that you suffered. And it gives you insight into all of this.
Yes.
Right. And I do this work because of my personal experience as well. 22 years ago, I had a son. I had significant postpartum depression. He graduated from college last week. He moved back home last night. So we did get through it, but it changed my life.
You do get through it.
And we have to move from the place where we're expecting the mom to find help. When we collectively, but the medical community needs to be talking about this issue from the moment a woman is pregnant, right? We can't wait till the postpartum period. Most of the cases start during pregnancy, whether it's anxiety or depression. We need to say from the moment a woman is pregnant, congratulations, it's great when you come to the OB, we're gonna test you for all these things every time we see you. We weigh you, we measure your belly, we listen to baby's heart rate, and I'm gonna ask you how you're doing. Normalize it. Anxiety and depression are the most common complications of pregnancy and childbirth. But you know what? There's resources, and let's get you connected with them before you fall off the cliff into the pit of anxiety and depression, and then you're trying to climb your way out. Like, I remember somebody gave me a card for behavioral health. I'm like, what is that? That's like, get a hold of your behavior, woman. Get yourself together. When what I really needed was somebody to say, hey, you know, let's talk about this, you know, and then trying to navigate the complex behavioral health system when I never navigated it before.
Right.
I apologize. I didn't know the difference between a psychiatrist and a psychologist. I had no idea what I was doing. And like you said, I would get on lists for things. I would call therapists. They wouldn't call back. Like, we need to give moms the knowledge and the resource to prevent them from falling off the cliff.
Absolutely. And thank you both for sharing your stories. I want to delve into this a little bit more because one of the things I think that we consistently hear, especially from Black women, is about the birth experience itself and how traumatic it was and what they endured just in that moment of actually giving birth, those hours leading up to it, those hours in the room. And Chandrika, I'm curious for you, how does that traumatic experience, whether that's not being listened to, being forced into a C-section versus a vaginal birth, things of that nature, how does that impact maternal mental health and lead to the recovery postpartum?
Absolutely. Thanks for this question. It's not talked about enough. Approximately 1 in 3 births are considered traumatic. And one of the considerations is that it's not recognized. It's considered, part of the experience perhaps in a way that it shouldn't be. One of the dynamics that we often see in our line of work is the feeling of loss of control, that dynamic. The ability, or the lack of ability rather, to not be able to feel like one is able to bring up the concerns that they might have in the moment, or sort of regret, or worse, blame themselves, or feel like it's a personal failure. My body didn't cooperate. So those are some of the things that we sometimes hear. So recognition that this may have happened. One of the protective factors in the data is having trust in the healthcare team, being able to perhaps have supports, being able to have the conversations with partners, for example, to be able to recognize sometimes in certain situations where it may feel like one's life is at risk or baby's life is at risk, that can be traumatic as well. And being able to have the ability to talk to someone or engage. And in some hospital settings, including ours, we do have psychologists inpatient to be able to offer support as well, but also working with the obstetric team during the postpartum visit. We've had experiences over the past few years where pediatricians may also provide screening, and they do see parents, and that's a natural way to also consider. So also considering pediatrics, they're seeing babies and families, so considering screening in those settings as well. Now, when it comes to how it affects maternal mental health specifically, it affects trust. And when it affects trust, it's hard to be able to engage and ask questions. Sometimes it leads to avoidance of needed health appointments. So for example, the ability to walk into the hospital where something happened, something scary, something really scary happened, right? Can be very triggering. And so being able to identify that and address such a barrier, for example, or considering a different office setting, so offering flexibility. Another consideration too is considering those triggers and how that might impact bonding and attachment, for example, because when one thinks of their birth experience, they may consider their baby, and how does that impact the ability to bond, and addressing that barrier, for example, because there are longer term outcomes if not addressed proactively.
Absolutely. And Stacey, there was a recent evidence review by JAMA Psychiatry that found maternal mental illness is the leading cause of pregnancy-related deaths for Black mothers, being twice as likely to experience maternal mental health condition, but half as likely to pursue treatment. What are some of the barriers that are keeping Black mothers from being able to either seek out that treatment or even access that treatment?
The response to that is twofold. It is one, getting over the stigma and the fear of being able to come forward and talk to your providers, being able to seek out therapists. I think that another focus that I want to make sure we bring into the conversation is maternal deserts that exist across the country. And it is not just in rural areas, but it's even in certain urban areas and settings as well. So being able to address those issues, and many times in some of the rural areas, you do have Black women and women of color, but women in general, who may have to go far, drive far, take several vehicles, or come up with alternative ways of being able to get to not only during the birthing process, but before, being able to get someone that they can talk to about the feelings that they're having and the emotions. So I think being able to have a conversation about maternal deserts is important, and you bring it into the fold of the conversation as we start to also look at how do we talk about maternal mental health and the impacts itself. I think that how you address it also, it's about educating. It's also about where you meet the families. March of Dimes has partnered with Mama, looking at an app that is actually used in the NICUs. It's presented to the mom, it's presented to the dad, it's presented to the family, where you're asking the questions, and it's safe for you to say, how are you feeling at this moment? Is there something that we can do? And so that's tracked, and then immediately the physicians and your attending therapists that are there are able to identify someone who can come and have that conversation with you in the NICU. And so we heard very early on at the beginning of this program and this convening, we actually heard by watching that screening of the father telling the story of how his wife felt at that moment being there in NICU. So I think it's about education. It's about doing it early. It's about taking away the stigma that comes from expressing your concerns, and then also continuing to educate the communities, educating people of color, Black women, birthing people, about why it's okay for you to seek help, but making it really available. I know I pointed out and talked about the maternity care deserts, but also looking at telehealth. How do we start to have those mothers who are not able necessarily to get to providers, to get to therapists, know exactly where to go to these groups that I kind of mentioned earlier, with me being right here in Alexandria, Virginia, but being able to find those, but being able now to rely on telehealth, telemedicine, and being able to connect in that way. And I think now I mentioned one app, but there's several other apps now that we're looking at partnering with to be able to connect moms early on.
Absolutely. Stacey, you started speaking about essentially a support group and having that support around you, and those who maybe might be able to start to say, hey, is something going on, and be able to start to have those conversations. And I want to stay on that for just a moment. And Adrienne, if you would like to chime in here on what does a support system look like, a healthy support system look like for somebody who, again, through the entire pregnancy, not just that postpartum, but from that moment where you find out you're pregnant, you're gonna be a parent, what should that support system look like?
Oh my gosh, I'm so glad you asked this, because this is one of the things I'm really passionate about, is like support groups, peer support. So, not everybody who experiences a maternal mental health condition necessarily needs to see a therapist or a psychiatrist. There's lots of things that we can do to support mom along the way. And it starts very, very basic with self-care. Right? Sleep, the most important, most effective, least expensive intervention, right? If a new mom in particular, can get 4 to 5 hours of connected sleep, right? Not waking up in between, that's the minimum that you need to survive at a normal rate. You can go for interrupted sleep for a short period of time, but if you're up every 2 or 3 hours for nights on end, for weeks on end, I have heard psychiatrists like Chandrika say, I can give mom all the medication in the world, but if she's not sleeping, she's not gonna get better. So sleep. Social support is so key. My mother, I remember talking to her about this. She's like, when she was having us, her mom lived down the street, her sister lived around the corner, all the moms were at home. There was this built-in village. We don't necessarily have that anymore. We don't live near our families of origin. Many moms go back to work. There's some crazy statistic of like 25% of new mothers go back to work within 2 weeks of having a baby.
Yes.
How is that possible? It's insane. We can't do this to women. So social support, whether it's, just commiserating, saying, oh, I went through this too, let's talk about it. It can be providing meals, watching the baby, holding the baby so mom can take a shower or take a nap. Support groups are so important, whether it's an informal support group, moms in your neighborhood or through your church or through a community-based setting. I mean, there's so much that we can do before we even have to connect with therapists and psychiatrists, right? Yeah. Not to take away from your business or anything,
but being able to get adequate sleep, being able to have conversations and have multi-layers of support, so important. And so practicing through the pandemic, prior to the pandemic, many services were in person. Out of necessity, many services pivoted to telehealth. Support groups have also switched to virtual, allowing accessibility, and also, as Stacey mentioned, removing barriers to care. So not having to consider childcare, not having to consider traffic and timing, and such, and being able to sort of engage in a way in one's comfort zone. One thing that we've noticed is that in terms of like the appointment show rates, for example, it improved with telehealth. So that also helped with engagement.
And I do want to add something to the conversation is the importance of doulas and also midwives. Midwifery has also plays an important role, and so of course by increasing that, making sure that states, as we know, continue to expand in terms of funding and reimbursements for those are helpful. But I also think you piggybacking a little bit off of your earlier question, how do you help women of color? How do Black women address this when it comes to this stigma? I think we now see a rise, an intentional rise in doula care and also midwifery, with that assistance being able to come in not only to the mother or the birthing person, but also to the family as a whole, being able to go through that process that can also help with their delivery. And when there is I won't say a disconnect, but there's a fear that exists. It's being able to help people get through that process during the pregnancy, not only during the pregnancy, but after the baby's here for that journey as well.
Absolutely. And we're in Washington, so I would be remiss not to mention our politicians. So we're going to pivot just a little bit to talk a little bit more about what we can see from our political leaders to help address this. And so, Adrienne, we saw the Task Force on Maternal Mental Health report to Congress this week. As a member of that task force, I want to take a moment to ask you very quickly, what was maybe the top thing that stood out for you in that report, or something that really just resonated, struck you? And then on the flip side of that, how do we start to bring this issue to our politicians' attention?
Okay, so wow, I could talk like half an hour just on this. I'll try to be brief. So what really struck me with the work of the task force and what came out in the report is how important it is to engage not only about mental health during this time period, but other issues like gender-based violence and social determinants of health. Like these things all come together. We had this opportunity in the perinatal period to really change the life course of not only the mother, but the child. We think about this during a routine pregnancy and first year of baby's life. Mom will interact with a healthcare provider about 25 times. 25 times with the opportunity to say, hey, new mom, how are you doing? What's it like living at home? Do you have enough diapers for your baby? Whatever, right? And to connect mom with resources that literally can change her life and the baby's life. And so that, I think, is what really, to me, resonated with the task force and with their various recommendations. So then how do we engage politicians more? I can't believe that we actually had a national task force on maternal mental health. Like, that is amazing. The White House supported it, Congress mandated it. Our politicians are starting to pay attention. So for example, one key thing that has happened over the last several years is that postpartum Medicaid Typically, so if a woman goes on Medicaid during pregnancy, and Medicaid covers about 40% of births in our country, so it covers a woman during pregnancy, and then it was 6 weeks postpartum. What we've seen now is that most of the states have extended that postpartum coverage for a full year, in part because of the data that we've been seeing about maternal mental health and the impact. So we hear about these suicides, right? 23% of maternal deaths are by suicide and overdose. And a lot of those are happening in the late postpartum time frame, 6 to 9 months. And so if a woman lost her coverage at 6 weeks, she's not seeing a healthcare provider. So by extending that coverage for a full year, we are going to be saving lives. So I think, the time is now. We are talking about this. We have our elected officials actively engaged. Yes. So I got about 5 more good years of work left in me before, I want to start thinking about retirement. So I got 5 years to push this through. So yeah.
Absolutely. Chandrika, how would you like to see our political leaders addressing this?
Similar to what Adrienne said, extending coverage through 1 year. We've seen individuals who have lost coverage prior to the extension who lost coverage at 2 months postpartum. 2 months postpartum. This is 2 weeks after a 6-week postpartum visit, and not allowing the ability to engage in care in a sustainable way, providing resources as possible, but it really limits the ability to access care. So that would be one major priority to consider.
I think for March of Dimes and for myself, we align with a lot of the things that Adrienne has mentioned with her alliance, and so our policy priorities are very similar. I think it's important that I would call on not only DC and right across the Hill, and here on the Hill, I would also say state. Hold your state elected officials responsible, especially your governors, your state legislatures, where a lot of bills and acts can be passed to be able to support people at the local level. I think for me, I would probably would be remiss if I didn't say on the federal level, we're advocating for, in the appropriations process that's happening now, it is to encourage Congress to pass support for HRSA funding. You heard the senator mention research and research dollars that are needed. I think we need to also encourage some of the things that March of Dimes are advocating for in the appropriations process. Is also an additional $10 million to help fund the maternal health hotline, maternal mental health crisis hotline. I think things like that are important. We're continuing to advocate for expansion of dollars put forth towards, as we've all mentioned, the need and the necessity for telehealth and telemonitoring of those patients, moms, and birthing people who don't have access quickly to doctors and providers, because the maternal deserts is definitely something that we've also got to be able to look at. So yeah, I could give you a whole laundry list of things I think we all got to be doing, but not only is it incumbent on the federal, congressional electeds, but it's also an important topic that we all here in this room and people who are joining us via streaming live, that you've got to talk to your elected officials at all levels, regardless of what your political views are. This is something that is impacting all of us across the country. And the one thing is, well, I don't have kids right now, but I tend to make sure I drive this home. You're not here without having a mom. So everyone in this room and everybody who's watching, everybody who reads, they all have a mom, and it's about being able to take what you hear here, what you're reading, and go back and talk about why it's important, because it impacts each and every one of us, directly and indirectly.
Can I just, you mentioned the hotline.
Yes.
So the National Maternal Mental Health Hotline, so we talk about not having enough resources. This is a free resource available to anybody, anywhere across the country. The number is 1-833-TLC-MAMA. It has now been in operation for 2 years, has helped over 35,000 women and families. It is a free resource. I also want to point out, this is an issue that is completely nonpartisan, right? We have, over the last 10 years or so, passed 3 pieces of legislation addressing maternal mental health, all bipartisan, bicameral. Each one of these pieces of legislation passed the first time they were introduced. It takes an average of 7 years for a piece of legislation to become law. First time. In the last Congress, there were over 10,000 pieces of legislation, 300 or so passed, and 2 of them were on maternal mental health. One established the task force on maternal mental health. The other provided funding for the National Maternal Mental Health Hotline and grants to states. And so, again, this is an issue, like Stacey said, everybody has a mom. We all started life as a baby. We all got to get behind this issue. So.
Absolutely. And I so wish that we could keep talking, because I know I could talk about this for hours, but just thank you so much to my panel for being here and talking about this very important conversation. Thank you so much.
Thank you.
Great job.